The race to get people vaccinated is even more urgent because of new and highly contagious variants of the virus. CBS News got rare access to a lab in South Africa studying one such mutation that appears to be resistant to antibodies. Foreign correspondent Debora Patta spoke with researchers about their concerns over this new variant.
Virus hunters in this high-risk biohazard lab in Durban are hot on the trail of the mutant strain spreading at breakneck speed across South Africa. The virus has mutated to attach more easily to human cells. The disease is no more deadly, but it spreads more easily.
We do believe that we are going through a new pandemic, which these variants that not only transmit much faster, but that also potentially has less neutralization.
Genetic scientist Tulio de Oliveira discovered the new variant after observing a dramatic uptick in infections in November. South African hospitals are overwhelmed, mortuaries overcrowded, and burial plots in short supply. De Oliveira's colleagues in the highly secured lab have developed a live culture of the strain to speed up research. The new strain here seems to have the ability to reduce the effectiveness of antibodies in people infected in the first wave. By how much?
So tenfold would be conservative. You can also have complete knockout.
Where there'd be no response at all.
That's right.
This means that those infected in the first wave could have little protection from the new strain. Even more troubling, it could render some of the vaccines less effective.
It's clear that we've underestimated this virus. On the other hand, the evidence is not there yet that vaccines will be affected, and certainly people should keep vaccinating because that's the solution to this pandemic.
Here at the country's central lab, scientists stress immunity is only part of the picture. Results on just how effective vaccines are against the new strain aren't due for a couple of weeks. But in the future, vaccines might have to be tweaked every now and again to protect against mutant strains, just like the annual flu shot. Debora Patta, CBS News, Johannesburg, South Africa.
Joining us now to talk more about the South African variant is John Moore. He's a professor of microbiology and immunology at Weill Cornell Medical College. Professor Moore, thank you so much for joining us. So the early studies on the South African variant show that it has some antibody resistance. Does that mean it could make the vaccine less effective? And why do you think antibodies are not working against this variant?
Well, yes, there are concerns here. There's a paper from the South African colleagues that you interviewed, and there's also a paper from a group at the Rockefeller University in New York that has started to look at vaccine sera and how they act against some of the mutations present in the South African virus. So the spike protein, the red blob on the outside of the virus that you can see in the image, that gets bent out of shape, which doesn't mean to say that we have to get bent out of shape because there is spare capacity in the vaccines. The amount of reduction in vaccine sensitivity so far in terms of the antibody response is modest and manageable, we think. There's plenty of spare capacity certainly for the RNA vaccines, in the antibody response they elicit. They induce a strong response so they can tolerate some reduction in it if that's eventually what happens. So we're certainly concerned about it, and we're watching it very closely as an international community. And it's essential that we reduce the ability of that variant and one like it in Brazil. We want to keep them out of this country as much as we possibly can. So the CDC travel bans and restrictions are very important in this regard. We don't want more of it here, even if it is already here to some extent.
And so right now, we're only seeing it in South Africa and Brazil, is that correct?
The South African strain has a cousin in Brazil. It's separate, but it seems to be similar, and early studies suggest that it will probably have similar properties. So they haven't yet been reported widely worldwide, and there needs to be much more monitoring of these variants. We've seen variants in the UK, we've seen variants arise in the States, but none of those are as troubling as the South African variant certainly is. It is troubling. And the Brazil variant is likely to be similar. So they're the ones that are most on our radar screens, but other variants do pop up. So far, of lesser concern. They're still more transmissible, and that's obviously a problem. But from the antibody resistance perspective, they seem to be less of a problem than the South African and Brazil ones.
And though since this variant is resistant to antibodies, I guess this is the piece of it I keep coming back to, because I have several friends, I must say, here in New York City who've had it and now have tested for the antibodies, and they have a certain amount of confidence. It may be misguided, but they feel they have a certain amount of protection even before getting the vaccine because they're not on the list yet to get the vaccine. That confidence may be misguided, but it sounds like anyone who's already had COVID-19 should not feel that they have any protection against this variant, correct?
Well, that's perhaps an overstatement. I mean, certainly it is true that if you've been infected, you have substantial resistance to reinfection, at least in the period that we've been able to study this virus since March and April of last year. But it may not be indefinite, but at the moment, most people are protected against a second infection. Now, the South African variant, if it became widespread here, might challenge that paradigm. We do not yet know, but there are indications that it is resistant to the kind of antibodies that were induced by the original strains. But look, all of these variants are stoppable by the same precautions that we should be using all along, masks and social distancing. There is nothing new from that perspective. So the vaccines should be able to deal with them, and the routine precautions we should all be taking would also prevent them spreading. So again, there's nothing fundamentally new. It's a change in the probability of infection, not an absolute.
Right. That is reassuring. And to your knowledge, there isn't a case of either the South African or the Brazilian variant of a second infection, meaning a patient who had COVID-19 already of the first variant and now has been infected again with this newer variant.
There hasn't been a reported case, and I do think that could happen with the South African virus. The lab-based studies are informative, but only tell part of the story, and the South Africans are going to be looking to see whether reinfections have happened. In the lab, from about half the people whose sera were tested in assays, those sera failed to protect against the new variant. The other half did. So again, there's a numbers game there, but that's a lab study, so we have to look in real people over time. But again, the South Africans are doing this. They'll do a very good job about it. But it is a potential concern if this virus spreads here that it could cause problems like that. But at the moment, we don't have it here, and it's not causing problems. And I really don't want people to change their behavior or to panic unnecessarily. The scientific community is onto this and will give the right information at the right time.
Right. All right. Well, Professor John Moore, thank you so much for your insight. We really appreciate it.
Thank you.